Hi, everyone. Welcome. Thank you for joining us today. This is a two-part series. And today we have part one with Remy on environment is the key to recovery-oriented transformation. Before I hand it off to her, I will just do some housekeeping information. Next slide, please. So this is an acknowledgement that was prepared by the New England MHTTC, and it basically is stating that all of the opinions and information shared today are not representative of SAMHSA's opinions. These are our own. Next slide, please. Thank you. So just some housekeeping information. Participant microphones are muted at the moment. However, they will be unmuted towards the Q&A session. Yep. And then if you have any questions during the chat, during the event, please use the chat. This session is being recorded and it will be available on our website by tomorrow. And if you do have any questions, you can always email us at newengland@mhttcnetwork.org. Next slide, please. And this is saying that the MHTTC network uses affirming, respectful, and recovery-oriented language in all of our activities. You can read them in more detail when we share the slides tomorrow. Next slide, please. And with that, I will hand it off to Grazi to introduce Remy. Thank you.
Thank you so much, Vanessa. So it's our pleasure to have you here. Please enjoy this webinar as much as I am. I want to introduce to you my colleague and dear friend Remy. She works at Mental Health Connecticut, and she will be talking today about create safety and engage environment through the person-centered planning and share her experience. So thank you so much. And Remy, please, the floor is yours.
Oh, thank you so much, Graziella, and thank you for having me here today. I know that people are really busy and an hour is a bit of time. So thank you for joining me. And I just want to let you know that this work is actually really, really important to me, not only in the work I've been doing for the past 30 years in the public mental health system, but also personally being a family member of someone who has some psychiatric and mental health struggles. And what we're going to be doing today is there's a whole notion that I've seen throughout the years, are we come up with these wonderful, well thought out, well researched tools, if you will, and initiatives that are meant to help the people that we're providing services to. And they're meant to work and help our workforce, which is super important. And they're also meant to be efficient. And so much time and thought is put into them. But one of the struggles I think everybody experiences is, how do we take this well thought out, planful, wonderful information we have and roll it out into systems of care, some that have many layers of infrastructure, some that don't, but we all have our set of barriers. So today what we're going to be doing is making sure, one is that we're kind of operationally defining what we're meaning by person-centered planning and environment, and taking a look at what we all know are some barriers out there, and some ways maybe we can circumvent those barriers. Talk about some kind of self-check tools, if you will, that we can use in our organizations and with the people we serve. You're going to check in, see where we're at, see how we're doing. And that'll help us do is kind of set the stage for the second part of this training, which really talks about, so how do you do it? When do you start? If you're an organization that hasn't used person-centered planning or doesn't know about it, all the way through being an agency that has known of it and practiced it with varying degrees of success or fidelity, if you will, throughout the years. So anyway, glad to be here today. Let's move on. If any, just a reminder, if anybody has any questions, just type them in the chat room and I will be checking periodically. Also, if you really want to just have your voice be heard, just let us know and we can unmute your mic. So, okay, So like I said, we just really want to set the stage by looking at this recovery-oriented, person-centered transformation, which means that it's come out, that it's being used, that it's front and center in what we do. By really looking at what kind of environment do we need to set up for this to be safe, where the human nature or the condition of being human is always front and center and very well appreciated and recognized. And how do we keep all these activities with the competing agendas out there and what have you, really activated, again, front, center, and moving and shaking all of the time. So person-centered planning, let's just talk about that a little bit. You know, over the years, I have read and I have researched, and by the way, learned through experience that there are many definitions out there about person-centered practice, person-centered planning. So much work done, you know, and I can't share everybody's names, but Janice Tandora and Larry Davidson, looking at like, what is this, right? And because there's so many ways to define it and there's no definitive definition, what we really kind of look at is what are the themes of person-centered planning that have really emerged in the literature, and also how has it defined itself when you look at what we're really doing, right? So I decided to take this upon just really looking for today's purposes at the core principles. So when we're talking about person-centered planning, what are we talking about? So first principle, obviously, is it has to do with the connection and the relationship between people who are providing a service, right? And program participants, right? People who are participating in services. And what does a respectful relationship look like, right? So not just from our point of view as a service provider, but asking people that are getting services, what feels good, what provides, what do you see in a relationship that you find you're heard, you're respected, you feel both emotionally and physically safe. So one of the core principles is that respectful relationship. Another principle we often see, and is very important, is front and center, by the way, is involvement of the person in really selecting and identifying their goals and what they want to see as a result of having certain services, okay? And it's not just focused on, as you know, symptom reduction, but rather how they're living their entire life, okay? And that is a life that includes things and connections outside of our service system. When you look at it, I would love somebody to be really, really busy and have so many other things going on that they don't necessarily have tons of time to be checking in. I mean, that after all is what a lot of people want, is to just have this as something that they need to look at and pay attention to in their life, but something that just doesn't kind of gobble them up. Okay, sorry here. Okay. Really looking at the importance of, again, drawing in at the person's discretion, because it's completely up to them. Who do they want involved? And, you know, families are made up of all shapes, forms, and sizes these days. Also, who people connect to in the community might not be what they would consider the nuclear family or extended family, but who is involved in their life, whom they trust and they're connected to, that they really want involved. And also hearing from the person that receives the services, what kind of involvement? Tell me what you're thinking. Help me understand how, you know, the corner store and the two people that own that might be important to you, or, you know, people down the street or your place of worship. Really making sure we are including all of what we call those natural resources in a person's life. Also, and this is really important, is the recognition that people have a right, as anybody else does, to do or take what we call responsible risk taking. It is a part of all of our growth in our lives, right? Unfortunately, I think everybody might shake their head if I could see you when I say, I know as a child and still sometimes as an adult, somebody might say to me, Remy, there's a pothole over there. You might want to walk around that, or it's slippery. You might want to change your shoes. And there are times I might choose differently. And it might be that my foot slips in the pothole, right? Or it might be that I'm on ground, I didn't change my shoes and I'm not having a really good time of it, right? We learn and we grow. And part of that is really kind of working with the person and planning what they want to do next and talking to them about not only it's important to keep our rights, right, in front and center, also needing to keep our commensurate responsibilities front and center, and to really talk to people about, okay, what do you think that's going to look like, right? And let's take a look at what some really great things can be that come of this decision, and what might be some not so wonderful things that come from you making that decision. And it's all part of that conversation, the way we relate to people and the way we connect to people. And that is when the people that we are providing services to can really begin to connect with us and trust. Okay. So under person-centered planning, what you really see is it's a value-based, there's core principles. You have this kind of what they call a bedrock. You know, what do we in our agencies, in our systems of care, and frankly, in our hearts, what do we truly believe, right? So you have the bedrock of beliefs, right? And we also have kind of the, under the core principles, just doing that, reflecting on the rolling out the practice, that reflection, you know, what's in the changes that happen in planning, and then really just kind of setting our expectations. That what we're talking about right now is what we'll really be focusing on in part 2. Today, again, is just making sure we're reviewing those core principles and looking at what some of the shared barriers are. Anyway, another core principle is focusing on acknowledging what that person carries with them, what they bring with them, their strengths, their natural talents, their interests, right? What motivates them, what makes them silly, what makes them happy, what makes them curious. And really digging in and asking the person and being openly curious about that to help them identify their strengths. And with those natural strengths and talents, what capacities come with that? That's huge and essential. You know, one of the things we always talk about in the working world is that when you're working and you want to, suppose you want to hire for someone to become a, let's say, a residential counselor. So somebody can come to you and they can have a golden resume. They can have graduated, you know, top of their class, so on and so forth. They can come in for the interview and ask great questions. They can be articulate, both verbally and in written form. But if they don't have that skill of connection with people or a core set of values that can really uphold this type of work, trying to train them would be really easy when it came to things that were technique. But if they didn't have that natural talent and affinity, it might be really, really hard to teach them how to connect with people, to teach them being able to listen really well, right? And to be comfortable. So point being is, let's take what that person comes with and their strengths and their abilities and their interests, and let's work and make our purpose having them recognize that in themselves, pulling on that to move forward in their lives and in their recovery, instead of trying to shove into that person something that's not necessarily natural, right? Or an affinity or an interest of theirs. Let's work with what that person has and take the time to get to know that. That's so huge. Okay. You know, we started out talking about that. I remember years ago with the integrated dual diagnosis initiative, which was incredible. And what it was really meant to do was to help people in the mental health field who weren't necessarily clinicians or didn't have their substance abuse certifications, who were probably doing residential work or even employment work. The idea was training people on how to work with folks who had substance use disorders. And again, it was meant to be more for people that were outside of the clinical realm, because we know that it's challenging when you have symptoms as well as, you know, you could be using substances. So they did this huge initiative. Everybody put a ton of money, time, effort. The trainings were unbelievable. And us here at Mental Health Connecticut have had different initiatives. And one of the things that's challenging is you learn the people that are with you at that time, they get trained, they get the resources they need. You might even form some ongoing groups or use time at preset meetings where you're kind of keeping this alive and front and center, right? And then what happens is competing agendas, right? Because we all have competing agendas. They kind of start coming in, and before you know it, some of the practices that we have done to keep our initiatives live and well start to fade out a bit, right? It's a very it's a difficult challenge. So let's just talk a little bit about that. So why is it hard to keep these things such as person-centered planning? There's a plethora of information out there. Yale and many others have done an outstanding job with trainings and availing all of this information, you know, into the public and private systems of care. It's all there, right? I remember it had to be 25 years ago when probably 25, 30 years ago, it was when Fairfield Hills was still open. And so they had different initiatives to have people coming out of Fairfield Hills into the community. And that was when all these community residential programs were starting to get grant funding. But the long story short is there was so many trainings offered at that time that within 10 to 15 years, had us looking at and thinking so much differently about what our roles were. Many, many years ago, our role was, okay, you're with us now, we've got it. Don't worry about it, we're gonna do this, we're gonna do that, we're gonna do everything we can, and it's gonna be fine. And never stopped to ask the person, hey, what are your hopes and dreams? If something were to miraculously happen, what would tomorrow look like, right? We never stopped. Anyway, the point being is we see some of these initiatives come and go, but we also learn, right? And because we learn, and because we find new ways of understanding how to work with people in the best way, our systems change, some of our policies and procedures change, not only at the state level, but also in our local agencies. So, you know, our system of care really has centralized and made important person-centered planning, recovery-based planning at the policy level. I mean, it was in the president's, I'm going to forget the name of it, the president's commission report on mental health. Anyway, I'm sorry if I just beat that up really badly, but in that report, it clearly said that person-centered practice was top important center stage, right? So locally, we all took that on at a policy level. And by the way, very hopefully, right, took that on and really was really interwoven in our systems. But when you look at the other side of it, the systems and the way funding worked really had us, for efficacy or what have you, really sticking to the biomedical view of health across the board, right? So that's where the rub starts, is how do we look at this person-centered person in charge of the recovery, central, the kinds of engagement we do. How do we do that and still be able to meet our grant expectations, you know, provide the amount of services that we need, and in a way that when it goes into, back then there weren't electronic health records, but when it went into a chart, or now into a medical health record, how would that pass muster with some of the accreditors out there, right? So, and we'll speak to that in part two, but there are and is hope that we can look and proceed with this recovery-centered wonderful work while still satisfying some of the standards around that, okay? Because if we look at the notion that the person is center, right, and really has agency in all of this, and agency in the services that are provided to them, there are still symptoms that they're working to reduce, right? There's still, unfortunately, there's still many co-occurring or comorbid medical vulnerabilities too. Anyway, there are many different ways to skin this cat in terms of getting that rub to reduce a little bit, okay? But it does make putting any concept or initiative that's still biomedically viewed into practice. Okay. I'll just say this loosely, but financial and legal constraints. Again, we all have different funding sources and our infrastructures are all very, very different, I'm sure. But we have to look at risk, right? When it comes to legal constraints, financial constraints, what are the resources that we need in place to be able to support and keep people trained and very knowledgeable? And how do we also support the accountability that needs to be in place when we have these initiatives, and we do want to keep them fresh and working well. And also, you know, a person plans and there's a responsibility there. Well, sometimes when you're in an inpatient unit, that has to look at it a little bit different because of legalities and safety. So another one of those challenges that we do have to keep in mind. Okay, this comes up all the time about a lot of the services that, or a lot of the people that we're working with, or some of the services are actually funded or billed through Medicaid, right? So, you know, it does require that services meet this, again, this medical necessity criteria. So how do you marry that with this person-centered planning, right? If you're keeping in mind that all of this person-centered planning has to do with listening, engagement, and the values behind that, it's doable. And again, we'll talk more about that in part 2. Again, why is it challenging to keep them alive again? So documentation of care. One of the things I remember, and many of you may work for organizations that are perhaps JCAHO accredited or CARF accredited, and they take a walk through documentation, right? And they kind of want to see that golden thread of person presents, this is what they're presenting with, what do you do after that? And there's a connection to what that person's presenting as challenges all the way through their stay with you, okay? And people are saying, well, how do we uphold that and kind of check that box without showing that, staying very kind of symptom-based, if you will, right? Because if we stay symptom-based right there, we're showing that medical necessity. Well, there are ways, and if you truly understand the nature of this person-centered planning, that you can certainly be person-centered while still looking at some symptomatology, okay? The difference is that it's not part and parcel and the only conversations you have with that person. I'm sure most of us, if we talk to somebody about what do you want to have happen, right? By virtue of being with us or accepting our services, many people are going to include not only once we've talked to them and they can start thinking of what I call thriving rather than just surviving, you're going to get some people wanting to deal with the way they're feeling naturally. All right. I think the biggest point that I want to make here is that that's not the bingo. That's not the bullseye. Okay. Again, healthcare reform sometimes, and it has to do again with cost savings and affordability and what have you. Sometimes it does. It drives out really outcome-focused agendas. But here's the kicker. If you look at this as an evidence-based practice, the outcomes are shown that people who are receiving person-centered recovery-focused care, the outcomes for symptom reduction, for engagement and longevity in necessary services as they deem them, and the decision on behalf of that person to utilize what they need to use to move towards recovery, whether that is a medication and utilizing medication, whether that's a combination of medication, really connecting back with some great natural resources, learning and working with our staff to get that light one day that says, you know what, my life isn't just about surviving. It's not just about having a goal that I want to stay in the community. Now I'm looking at, all right, sure, I want to stay in the community, that's a given. But what do I want to do in the community that has me feeling connected and alive and purposeful, right? And has me wanting to get out of bed in the morning. So reform can only drive so far. If we look at outcomes, let's make those outcomes based upon, and even if they're the driver of it, even if it is oh, your length of stay is going to be less than a year and a half, or I don't even know if they're using MGAF scores anymore, but your DLA 20 scores will move up. When we're doing this kind of work, everybody, the outcomes are great. So again, it's going to take some work, some ingenuity, and it's going to take some trying and then having to course correct. Biggest challenge is buy-in and sustainability. So I'm thinking today that I'm probably talking with folks who, I'm just going to check the chat. Okay. Probably talking with folks who have already utilized person-centered care, person-centered planning, recovery focused. I think a lot of these terms we use interchangeably, but if we look at those core principles, so we're either using them now and using them in a way that we're happy with and we think really honors the principles, or we're using them, but we don't really think, or we think there's been some drift, if you will, or mission creep away from some of those principles in light of some of those competing agendas, or we've never really focused or rolled this initiative out. And I'm sure there's a mix of people here today with those different experiences. So one of the things we want to talk about is, I'm sorry, I have froze here. So let me try to unfreeze. There we go. Okay. How do we make some decisions? Where do we decide to look? Okay. And the first thing I just wanted to talk to you about, and I'll do a little time check here because I want to leave time for questions and answers. Okay. So about a good 15 minutes. So leadership support, whether this is new, whether you want to breathe new life into it, whether it's here, but it needs some dusting off. It takes a conversation, and it takes a conversation with between leadership and staff, right? Because you can have leadership who have decided this is, who have made the decision something has to change, right? And so perhaps even if it sits on the agency's strategic plan, to like reinvest in this or to begin using it. So you have that leadership support. They're putting it on the plan, right? If you have a board of directors, if it's on a strategic plan, that's part of your charge, right? But you also need to be talking to people that are doing this work every day. Because in real life, and when rubber meets the road, the people that are doing the work every day, it's got to mesh, okay? And training, practice, oversight, really looking at, and we'll talk about some surveying later, but really, where are people, how are staff feeling with this? How comfortable are they feeling with it? Do they feel like they have the tools they need? Where is the accountability? Are they clear about what the use of this is? So again, not just initiatives coming from the top down, but also leadership and people doing the work coming to the table and really sussing out what it needs to look like. Again, to either start it, dust it off, or just breathe a new life into it. It's going to take that. Also, if this happens to be a new initiative, or even you want to do what I would call like a relaunch, how are we talking to people about this, right? How are we in leadership or in supervisory or even peer-to-peer? How are we talking about this, right? How are we messaging it? Are we putting out there as just something else, putting it out there in a way that people go, oh my gosh, this is just another thing. It's just going to be like soup du jour or what have you, or what we're focused on for now. How do we make it different? One of the first ways we start to make it different is by messaging it in a way that really engages folks and has them see from the get-go why doing this kind of work is not just something else you have to do or remember or learn. Learning this work gives us so much more that we need to be able to actually, as workers, thrive doing our work and to help the individuals that we're providing services to thrive. It's not extra work. It actually makes work more efficient. And there's a lot, really, really kind of increased satisfaction. And so we need to message it in that way. One of the things I looked at and we had done, and some of this is through, guys, research I've done, a lot of it is through experience. at agencies I've worked for, but and currently here at MHC, first you got to kind of figure out, well, where are we in this? How are we doing? Are we not doing it all? Doing it at all? Okay, that's clear, right? We want to look at this. We want to be able to understand why it's useful, why we want to bring it on board. And again, if you're doing it, let's look at, are you really doing it? If you look at the measures, one of them is, and there's so many out there, by the way, but I wanted to put some of these up here because they're really handy dandy and you can access them very easily. There's fidelity, which is how are we doing with all kind of the benchmarks with person-centered planning. There's the person-centered care questionnaire. I mean, Janice Tandora has done a ton of them, and so has many of her colleagues through Yale. But and in some of these person-centered care questionnaires, they have them on certain levels. So they'll have a questionnaire that you can give to the people you're serving that ask questions along the lines of, you know, how involved have you been in your treatment? You can leverage information about, does somebody feel emotionally safe? Do they feel physically safe? Do they know who to get to? Are they front and center in decision making? So on and so forth, which is an excellent tool. Gaining knowledge, checking in on where our staff and leadership around knowledge with the benchmarks and what have you. They have the recovery knowledge inventory, which is wonderful. Also looking at whenever you're starting a new initiative or really just having to rebrand it and get it out there, is our organization ready? The AS's multi-level leadership quality scale is great for really kind of feeling into what is the culture right now ready for it? Where is our organization? This organizational readiness climate scale. And believe me, in my practice, this is not about just doing a bunch of inventories and calling it a day. It's deciding which ones you find will be useful and can really guide you in the best way, right? And your path or your road is going to be different depending on your use of it right now, okay? So organizationally, the readiness climate scale is wonderful to look at. And again, there's another self-assessment scale, recovery self-assessment scale, put out by O'Connell, Tandora, Krug, Evans, and Davidson. What I like about the fidelity for the person-centered care questionnaire and this recovery self-assessment is they're not only assessing and asking questions of the person served, but they're also asking staff to take a look at, you know, kind of scale themselves and where they're at in the service delivery. And there's also skills available for leadership to be looking at, hey, how are we supporting our staff here? Where and what vehicles are we using to be able to keep this front and center? Are we having discussions about the use of person-centered planning in our one-to-one development time with people? Is there time being taken at our meetings or whatever naturally occurring meetings we have where we're looking at that and looking at this and we're giving people a chance to talk about what's hard, what's easy, what's worked? Have they had opportunities to really be using this? And if they haven't, why? You know, what needs to happen differently? But super, super important at an agency level to really kind of know where you're at. Question to ask when we're looking at ourselves, right? Not only look at ourselves, but remember looking and asking and being curious. And I mean, naturally, genuinely curious. Asking people, guys, this is what person-centered planning is. I have a scale here. Would you mind taking a second with me? We really want to check. We want to check on how we're doing. You know, let's say as a practitioner with a program participant, you know, I really want to check in. You know, I'm really want to value and work with you in a way that you feel satisfied and respected. Can I ask you some questions? Get feedback from people. And for people who want to just answer the questionnaire on their own, you know, and want that privacy, leave it with them. Internally, let's start saying, are we using this? Are we really using this? And kind of scaling ourselves and having this fluid, open conversations, because we all know, you know, there are this is an initiative. This is something that really takes practice. It's like a muscle. It takes practice, and it takes it front and present for quite a long time, and retraining when there's staff turnover to really keep it or allow it to become part of the culture and part of everyday language. And I can tell you that when this is practiced and when it's resourced and when it is remains really kind of front and center and important, okay, and just takes up that space, I could tell you that it does sound or becomes natural. You're going to start hearing language, small changes in language, changes in the way people are presenting themselves with the program participants. So it's actually beautiful to see. So if you're new doing this or relaunching, so what's working? What part of this is working? Okay, we're starting to roll it out now. We're starting to resource it. What's going really well here, guys? And you know what? What are we tripping over? What's going on, right? Where are the barriers? Barriers, great opportunity to learn. It could be something smack dab that you're just not seeing, or it could be something that you have to work on. Is it you're working with staff that maybe have been in the field for a long time and haven't quite absorbed or haven't quite incorporated kind of this new way of looking at things? If so, let's have conversations, right? Things have changed. I know probably a lot of you out there have been in the field for a while. I know it's changed. And I look back, by the way, historically on my time in the field, and I'm very proud of it, but I'm also humbled. I can remember a time where it was very much that we were going to come in and fix things. And boy, it was from our hearts that we wanted to do it. There was no malevolency behind it whatsoever. But it was kind of move out of my way. I got you, right? I'm going to get you a doctor. We're going to get an apartment and we're going to do this and that, and never slow down to take a breath and say to that person, my gosh, this is an apartment, right? You haven't had your own place for a while. Let's just sit and talk about that and slow it down. Slow it down. If we don't slow down, we're not going to hear. If we don't ask questions, we're not going to hear what we want to hear, what we need to hear, excuse me. That's incumbent upon us. So let's look when we're doing this, what's working, what's not working, what walls are we literally bashing into? Were they there before? Okay, let's take a look at them. How do we remove them, or how do we course correct them, right? So it really is about looking out ahead of time, but also as you process through, what are the barriers here? Where do they come from? Once you do that, you can say, okay, is it a training issue? Is it kind of bringing people up to speed with and really, really understanding not only the importance of this, but how you engage differently when they've been engaging as more of a caretaker for years, maybe, right? Or they have to shift from seeing maybe the person as more of a passive recipient of services into somebody who's actually not only participating, but center. That takes time, guys. It's a shift. And we all know change. Who wants change, right? It's tough. You might have to look at your resource allocation, whenever you're trying to breathe something new in or bring it front and center again. Resources, and I don't mean just money, time resources, infrastructure resources. You may have someone who, or depending on the size of your agency, several people that really take this on as their kind of their role for a while. So it gets the attention it needs until it becomes a more natural part or part of the culture, if you will, right? And as you're weaving this in, you're going to see, as it becomes more and more part of your culture, you're going to start seeing shifts in the climate of your organization. So that's the general overall feeling that somebody could describe who's getting services from you. That should start shifting and changing. And the reason I put strategic plan in here is because sometimes to get it sitting front and center, if your agency does your strategic planning, whether it's every 3 years or whatever, we know that's the major driver of a lot of private, non-for-profits. Let it sit there, let it be there, okay? Because that can help reroute some of the resources and allow you to allocate them a bit differently, right? I didn't want it to make it so technical and dry, but sometimes when you get on the strategic plan, you get better support. This might take, if you're already doing it and you're sitting here going, oh my God, we do all this, we've got this down pat, stop and take a look. Take a look. Look at people that are newly on board. Take a look at the services that are being provided and how people see their role. Stop and do that check. One of the things I do with people 30 days in, 90 days after, And a year into their tenure with us is we just have groups of people, and I ask them on a big, huge Post-it note, write down what you feel your role is, just, free association, guys. And I watched to see if that changes. Are people writing down caretaker, right? Are they writing down pseudo family member, advocate, teacher? How is that language starting to change, right? Are we starting to see partner, collaborator, coach, what have you? I find many times you could feel climate change through the language that's being used and the way people describe the role. Check in on that a lot. It gives you a lot more information than you would think. Let me just see where we are here. Okay, a couple more minutes here. I would just want to give you a little bit, before we ask questions, just a little bit of information on where we're taking this. So what I've done today is try to set the stage for, okay, what are the principles we're even talking about here? Okay, we've looked at what are some of the barriers or things that happen that make it really hard for initiatives that are so important, that are evidence-based to show better outcomes. Not only that, but ethicality-wise, and in my heart, this feels right. And I don't think I could be doing this work and have it so front and center stage in what I do. It feels right. It is definitely that person first. And as a family member, I can tell you, even my experience with my family member getting services, what a different feeling it is. You could tell what provider you're working with and who is really doing this work and really invested in it. And if the staff member really feels comfortable with it, if it seems genuine. So I want to set the stage for, okay, these are some of the ways that can get in the way of creating environments that really support this person-centered planning, or making it safe to do it and people feeling comfortable. When we meet again, what I really want to do is say, okay, so where do we start? I got my hands up in the air now, where do we start, right? Doesn't matter if you've done it before or you're doing it for the first time. I always say, and this will make no sense, but it comes out of my mouth, is it starts before it begins. What I mean by that is it starts with when we're putting out, we all have openings, right? I'm sure. How are we languaging the ads that we put out? Even if it's, state. How are we sharing what these positions are and what their charges and what the responsibilities are? What are the language we're using? How are people first seeing what it is they might be interested in doing? It starts at the beginning. It goes all the way through questions we're asking people when we're interviewing them and when we're recruiting that can really suss out, does that person have some of that natural affinity? Because we're not going to be able to teach that, right? We could teach technology and we can teach some skills. We can't put that heart, passion, and true understanding, right? We got to have some natural affinity for that. And then when somebody comes on board, how do they first know it's part of our culture? How do we introduce that to that person, right? And where does it live and breathe for the rest of the time so it can remain alive and well? And that, in all of its simplicity, is how we can keep this front and center stage where it belongs. So I'm going to stop there. And we have a little under 15 minutes. I'm going to stop there and, open up the floor for any questions you may have, comments, or just sharing what your experience has been with using and utilizing person-centered planning and recovery oriented services in your place of work.
Thank you, Remy.
You're welcome.
For this wonderful presentation. I just wanted to let people know that the microphones have been enabled if you want to speak up and ask your question out loud. We just ask that you're mindful of background noise. If you're not speaking, to please keep your mic muted. Thank you.
Thanks. I'm just checking the chat. Chat's pretty empty. Did I hit you guys after lunch?
Remy, it's Graziella. I would like to thank you too for this outstanding presentation. It's amazing to see how recovery and system and recovery and practice works and works well. So I have a question. Can you please just talk a little bit more about sustainability? because we know that some of us, some of agencies and programs, we have been training in person-centered care, we have been training in recovery-oriented practice. But by the way, the time passed, and like you said in the beginning of your presentation, we have a full agenda. And it's easy to us to get lost when
Yes.
we have so many things to do. And then you need to keep in working with
Yes.
the organization and also with the members of these organizations and all levels, not only the workers, but the management, not only the clinicians, but the management level, to sometimes to reveal the skills that we thought that worked so well. But when you come with a new approach, with new intervention that will be connecting more and looking for the needs that the population that you serve, could be a little bit difficult.
Absolutely.
You can maybe have more time to do these adaptations and transform the system, because systems are made by people, and sometimes people need time to review skills. So how
Absolutely.
it works, and what are from your experience, so what are the tips, or what you can share with us?
Okay. So if I'm understanding your question correctly, so because you're hitting the nail right on the head, Graciela, around, like, for some people it's new, right? And we all know that one of the first things that happens when something new occurs is immediately people get nervous, right? Like, what does it mean for me? How's it going to impact me? Why would I be interested in this? Oh my gosh, I just learned something, what is this going to look like for me? People get really nervous around change. And by the way, folks, if you're doing the work now too, we also have to keep in mind that we've had a pretty bumpy couple of years, right? The first thing I say, Graciela, and a lot of this we're going to kind of do step by step next week, but I think the question you're asking, how do you make it a little bit, how do you kind of bring it in a way that people are more open to it? Was that kind of your question?
Yes, it is.
Yeah. The first thing is, especially if it's new or you have to kind of do a grand relaunch, is messaging it. So every agency or place has a different way they do messaging. A lot of people do everything via email. Some people do it through newsletters. Some people, all the departments have heads or whatever, do a big meeting. And maybe all the supervisors meet with their staff once a week, whatever, what have you. But start up front, deciding a couple things is, how do you want to frame this, right? How do you want people to hear this and why you're doing it, right? It's going to be really important. Okay, let me just give you a quick example. I'll make it quick. I was complaining one day about why do people always think training is the best day to either call in sick or forget you have it or not go to it, right? And gosh darn it, it's been like that. And why don't people see training and realize how important it is? And even though it might be a pain and not so fun, they're going to take some skills away. They might, even if you learn one new thing, it's worth it, and we need to keep fresh. And somebody in our development department said to me, Remy, she said, how do you advertise your trainings? And I said, well, what do you mean by that? Right? And she said, well, how do you let people know that this isn't just a have-to kind of thing, that it's really going to be helpful, that you can make them fun and entertaining, and people can really value them. And this is actually a gift, right? And I thought, well, I ate a piece of humble pie that day because we hadn't been framing our education opportunities for people in a way that would garner anyone's interest, right? And I found when I redid the messaging and even renaming some of the trainings and really upfront telling people that this is a way to support their work and to support them moving forward in this work, in a way that really upholds resiliency and feels good, that's the first place to go. How we message it and how we frame it, right? We're offering you this, we're offering you this gift, all right? And with supports around that is going to go a lot further than, okay, guys, we're rolling out this new initiative and here is the fidelity list. And by April, here's your rollout plan and you need to hit your marks. And by the end of next year, we have to have 80% fidelity. And yes, we will give you training and there'll be a lot of training, right? Sounds a lot different than, you know what? We really have decided, right? We've decided through conversations with not only staff, but maybe even the board of directors that we need to approach our service a little bit differently. Not only so it bolsters how effective we are, but also creates a safer and a more emotionally safe environment, also physically safe, right? Because we're not in the business of telling people what to do and challenging. You are a participant. Come with me and walk this journey, right? And isn't that great to be able to offer people? And by the way, as a staff person, how's that fit? Try it on. Much different than the approach I was just telling you about, where it's going to be all gears and whistles and timelines. Have people understand the true value. Huge is first step, right? And again, it starts with, what is your advertisement pulling in? Like when somebody's looking at, if your stuff is on Indeed or on the state, state website for positions, what are we naming our positions and how are we describing them? Right in there, some of the language we're using has to change because people who are drawing into this field need to start understanding that things have changed, right? And I'm going to tell you this, I tell everybody I've got to tell you that within onboarding, the first week, people already understand that we work with people in partnership. There's no hierarchy as in client or service recipient and staff person. We're two human beings, both with souls, right? Both with hopes, dreams, wishes, and fears and fantasy, right? Maybe the person who receives the services forgot, right? Or got buried. But guess what? We're here as partners and you're going to see that again and you're going to remember. What a way to walk with somebody that's so much different than some of the, okay, we got to get this done. And, you have to, remember, big thing is, we got to take care of your money or your rent's going to, all that's going to come. And yes, we can't ignore it. But why don't we start our journey out a little bit differently, not only for the people that we're serving, but for our staff members. So right up front when they come in the door, let's start talking to them about what they see their role as being and maybe help correct or dig in and challenge some, maybe the misperceptions they have or misunderstandings, or sometimes people just don't know what they don't know, right? A lot of that's based out of fear or just not having been doing this work for a while, right? And how do we support it? How do we support it in our one-to-one development time with people, or for some people called supervision, right? What naturally existing meetings or vehicles do we have that we could be doing? I do keep it alive sessions all the time. We use either some of our directors meetings, we do it at the directors level, or you could do it at your local team level. It doesn't matter. We do role playing, exercises. We have people report on what was the best thing that happened in the week where they used that this person-centered planning and engagement. Tell me about a moment that took your breath away, right? And tell me about a moment that you messed up. Bad day, you had a really great opportunity to engage with somebody in this way and you didn't. Let's talk about it. What happened? What happened, right? Let's stop pretending that the people doing this work are not human.
Yeah, that's wonderful. And that's just have a question in the chat that it's relate what we were talking right now. If you can answer.
That's actually a great question. Yeah, that's another one of the challenges, or people might not be at that place right then and there, or you might be all about doing it, but you're talking to someone. Okay, so let's do, does it improve treatment outcomes? Yes, it is shown that, and I'm doing this off of memory. I know 3 things for sure that has shown that people have elected to use resources, including medication. That's just a study they did. I don't want you to think that's always front and center. They have elected to utilize medications that work as part of their recovery. Some people call that med compliance. I don't think the word compliant. I don't want anybody to be compliant. I want them to know what they're doing, right? I want them to speak to it. I want them to make a choice, right? So people tend to use better choices. The service recipients report better satisfaction in their relationships with staff and their connection. And they also report increased satisfaction with just feeling respected and, of course, integral and part of that practice and recognized. So yeah, and when you're working with someone, guys, who's not quite there yet, everybody, sometimes we got to put all that down, and we might need to put it down for several visits and just sit and listen. Sometimes it starts with just engaging with that person, and they might not be feeling so well. Maybe it's a bad day. Maybe their symptoms are pretty, you know, alive and kicking. Give them the time, listen, just listen. You'll get to a place where you learn so much more sometimes by just listening and slowing down your agenda until you're really, really ready for that person to share with you. They will share. I think we're going over time. Did I answer your question?
We're just at the time. So yes, so I can see here, Pipson, yes, thank you.
Okay,
Excellent,
yep.
excellent webinar, excellent training. So
That's wonderful.
said that, I would like to thank you so much for this presentation today, Remy, and also I would like to let the participants know that we'll be here next week. If you enjoy, if you like, great presentation, thank you. So people just write.
You're welcome.
Right now. Just
please join me
week,
because
right? Next week we'll continue this conversation, and I also would like to ask you to answer our survey. It is important to us to know your thoughts, your idea. So you know what you have to say to us matter. And said that, I would like to again thank you, thank Mental Health Connecticut for this wonderful presentation. You have access to this presentation, the PowerPoint, tomorrow. Please visit our website and please answer the survey. And thank you all. Have a wonderful afternoon, wonderful week. See you here next week. Thank you, and thank you again.
Thank you so much for having me. And next week is a great chance for us to really have discussion and really get into the details. So thank you so much for having me today. It was wonderful.